We've all had those little sharp-edged x-rays they stick in your mouth at the dentist. But today, we're going to look beyond the bite wing. We're going to explore the amazing tech that gives dentists a much, much bigger picture of your health.
Okay, so let's get right into it. We've all done that awkward bite down on that little piece of film. But what's the deal with that other machine? You know the one, the big one that kind of slowly spins all the way around your head. What's it even looking for, and how does it work? Well, sometimes to really solve a puzzle, you need to see the whole board, right? Not just one little piece. It's the exact same idea in dentistry. Those small x-rays, they're fantastic for finding a cavity. But a lot of the time, dentists need to zoom out and see the whole story. And that brings us to the two main families of dental imaging. First, you've got intraoral. That's the one you know. It's taken inside the mouth and gives you incredible detail on just a few teeth. But then you have extraoral imaging. This happens completely outside your mouth, and it's all about capturing the big picture, your entire jaw, your sinuses, every single tooth, all in one go. So when we talk about that big picture, the most common tool for the job is the panoramic X-ray. This is really the workhorse for getting a complete overview of your entire dental landscape. So what's in it for you, the patient? Well, first off, the dentist gets to see everything at once, the whole shebang. Plus, the procedure is super quick and way more comfortable because, there's nothing actually in your mouth. And this is really important. It can actually be less overall radiation than getting a full mouth series or all those little individual x-rays. Okay, but that leads to a pretty obvious question, right? Your jaw is a giant curve. So how on earth does one machine take a single flat picture of the whole thing? The answer is actually pretty brilliant.
All right, let's pull back the curtain and see how this thing is put together. The machine isn't just taking one static snapshot. Oh no, it's building a picture while everything is in motion. I want you to think of it like this: carefully choreographed dance. As the X-ray source is rotating behind your head, the sensor is rotating in perfect sync right in front of your head. And all the while, the computer is playing the director, digitally stitching all of these moving viewpoints into one single, wide, seamless panoramic image. It's pretty cool.
Now, the secret sauce that makes this all work is a concept called the focal trough. It's basically an imaginary, three-dimensional, horseshoe-shaped area and space. And for that final image to be sharp and clear, your jaw has to be positioned perfectly inside this invisible sweet spot.
So you can see why positioning you in that machine isn't just about making sure you're comfortable. It is a technical skill that is absolutely critical to getting a good, usable diagnostic image.
And what happens if you're even a tiny bit off? Well, the results can look really, really strange. But what's cool is those weird results actually tell the technician exactly what went wrong.
Take a look at this. It perfectly shows what I mean. If your chin is tipped up just a little too high, you get what they call a reverse smile line. The X-ray literally looks like it's frowning at you. And if you tip your chin too low, you get an exaggerated smile line, like a giant cartoonish grin. And the same thing happens with your bite. If you bite too far back on that little plastic block, your front teeth show up looking all fat and blurry. But if you bite too far forward, they look super skinny and narrow. It really is all about hitting that focal trough just right. Okay, so that's the two-dimensional picture. But as amazing as a panoramic image is, it's still flat. So what's the next level? Well, the next major leap in dental imaging literally adds a whole new dimension. This is called cone beam computed tomography, or CBCT. You see, a traditional medical CT scan uses a fan-shaped beam to take these little 2D slices of you, kind of like a loaf of bread. But a dental CBCT is different. It uses a cone-shaped beam, and in one single rotation, it captures a full 3D volume of data. It basically gets the whole loaf at once. And get this, the time it takes to capture this entire detailed 3D model of your head, we're talking 7 to 30 seconds, that's it. In less than half a minute, the machine has everything it needs to build a complete digital reconstruction. It's just incredible. So why is having a 3D view such a total game changer? It's because it lets dentists see relationships between different parts of your jaw and teeth that are just invisible on a flat 2D X-ray. It's the difference between looking at a paper map and using a live 3D GPS. And this just blows the doors wide open for diagnostics. I mean, think about it. With a 3D model, a surgeon can plan a dental implant with pinpoint accuracy, knowing exactly where the bone is, where the nerves are.
They can map out the safest way to remove an impacted wisdom tooth to avoid any complications. They can see the tiniest details of the jaw joint to figure out what's causing pain, or even find and measure tumors with unbelievable precision. This isn't just a picture anymore. It's a complete anatomical blueprint. So, where is all of this headed? Well, the experts behind this research predict that one day, this kind of 3D imaging is going to become the absolute standard of care. That means, for complex stuff, this powerful 3D view might not be the exception, but the new rule. Basically moving dentistry from educated guesswork to GPS-level precision.